All right, I'm going to ask everybody to take their seat. We're going to start the next group of talks. This is still part of the epilepsy session, but we've got 10 talks to do in a relatively short time, and we're running over. So first up is Lisa Merlin. Lisa, the floor.
Thank you, Mark. So the title of my talk is Neuroscience at Downstate, A Career is Born. And by the time I get to my last slide, you'll understand why I entitled my talk that way. My abstract, the title I gave was A Tale of Two Interests. So I couldn't quite decide on a title because I actually have two significant research areas. I am known nationally for both independently. And by the way, I'm going to be saying a lot of I do this, I did that. I'm not saying it to brag about myself, but rather to brag about Downstate and what Downstate can do. If you're a student or a resident, you'll understand by the time I get to the end here why I'm saying all that. But it's Downstate that gets much of the credit for the things I'm going to present today. So I have two significant research areas. One is in the lab of Bob Wong, at least it started there. He was my research mentor and then became my collaborator. And I've had an extraordinary career trajectory with him, studying the basic mechanisms of epileptogenesis. So what I mean by epileptogenesis, as opposed to ictogenesis, is the conversion of normal brain to epileptic brain. And by epileptic brain, I mean brain tissue that has a persistent propensity to produce epileptic length discharges. Okay, so it's a hyperexcitable slice. So my work is in hippocampal slices, as you see in the photo there. And my main claim to fame, in collaboration with Bob, was noticing that metabotropic glutamate receptors, and specifically group 1 metabotropic glutamate receptors, play a significant role in not only ictogenesis, so it can convert interictal length discharges into ictal length discharges when you activate group 1 metabotropic glutamate receptors. But unlike other models where you wash out the activating agent and the slice goes back to normal, the changes persist in this model, suggesting an epileptogenic process is being induced. So that's my epileptogenesis basic mechanisms. I'll talk a little bit more about that on the next slide, but my second area of interest is innovation in education, and I've actually had funded research projects and publications along those lines. I created the clinical neurosciences pathway as a mechanism to allow students to get more exposure to neuroeducation, despite the fact that the school's curriculum gives us a limited time to teach you guys. So we have only 10 weeks in the preclinical curriculum. We have 4 weeks in the clinical curriculum. I wanted to sneak more in there. I petitioned for more time and fell on deaf ears. So to get around that, I created the clinical neurosciences pathway, and now there are a ton of other pathways that the school has, but we were the first, going back to around 2005 or so. And in fact, to kick it off, I did get a grant from Novartis for that. I created, together with colleagues in the American Academy of Neurology, we created a longitudinal competency-based curriculum that spans from year 1 to year 4 in medical education in the neurosciences. We published that. I spearheaded that effort with a bunch of colleagues there. And I continue to be director of both Unit 6 and the clerkship in order to ensure that longitudinal experience for our medical students. And my latest accomplishment in education, in the education arena, is the creation of a brand new residency program. Just got accredited 2 weeks ago, as a matter of fact, at One Brooklyn Health, Brookdale Hospital. We will now have 5 residents per year. Our first batch of 5 will be starting in July. So 2 areas for innovation. So let's start with our epilepsy work. So again, it's in vitro recordings, hippocampal slice preparation. We induce interictal spikes in the slice prep by using picrotoxin to inhibit GABA A activation, and all you get, going back, is bursts that look like that. Okay, they're a fraction of a second long, synchronized bursts. This is recordings from CA3 intracellular recording. And you don't get ictal length discharges, you get interictal length discharges. But when you add an agent that activates group 1 metabotropic glutamate receptors, it will convert these short bursts into these prolonged bursts. okay, that look more like an ictal length event. Certainly if that was happening in vivo, it would be long enough. It's over a second in duration, so there should be a clinical manifestation that would go with that. So we consider those ictiform length discharges. And when you wash out the agent, you see it looks like it's washing out, the length is coming down, but then you see that there's a prolonged, persistence of these long bursts, showing that epileptogenesis has occurred. So many other animal models have been used to create ictal length discharges, and when they develop drugs for epilepsy, they've used those models to determine whether or not the drugs suppress the seizures. But unfortunately, at the moment, we do not have drugs that can prevent epileptogenesis. We only have drugs that suppress seizures. So the hope is that with this model, where we see that this model can actually create an epileptic slice and not just create seizures that wash out after you remove the drug, perhaps if you can prevent this induction process from occurring, you could create a medication that could perhaps suppress the epileptogenic process. So when do we have the opportunity to do that? Obviously, people born with epilepsy, you don't have that opportunity. But people who have, say, a cortical stroke or head trauma, a few months down the line, they develop epilepsy, post-traumatic epilepsy, post-stroke epilepsy. It's possible that that induction mechanism there might be due to massive glutamate release that then recruits the group 1 metabotropic glutamate receptors and leads to an epileptogenic process. This is just hypothesis. I haven't proven any of this yet, but picturing this scenario, it is theoretically possible that suppressing those group 1 mGluRs or pathways involved with those receptors might be a pathway to suppress epileptogenesis. Okay. What?
You have a minute and a half.
Seriously? Oh my gosh. Okay. Education research endeavors, you can read for yourself. No, I'll just quickly go through. We've got the clerkship. I've studied different designs of the clerkship. I've incorporated more pediatric neurology and outpatient neurology. I've developed the guidelines, as I mentioned. I've incorporated essays and OSCE exams to better assess student knowledge in the preclinical and the clinical curriculum, so that they can so that we can better assess, as opposed to just relying on multiple choice exams. We have standardized write-up grading, resident as teacher, but the most important slide here really is this one. Okay, this is the crux of my presentation. I am a simple girl from Brooklyn. I went to medical school to become a doctor. That's all I ever wanted. I was going to go into primary care, and I came to medical school, and I came to Downstate because it was in Brooklyn. I was from Brooklyn. Downstate's in Brooklyn. It was convenient, and the price was right, too. So I came to Downstate. At Downstate, I was surrounded by neuroscientists and neurologists who inspired me and who turned me on to neurology and neuroscience and a scholarly approach to the logic of the nervous system. I was just totally turned on. And Brian and Siska, luckily for me, number one, created the neurology clerkship at Downstate. Okay, he is the one who pushed the school to insist to have a required clerkship in the third year. Most schools across the nation did not yet have that. I was the second cohort of students at Downstate to benefit from that addition to my curriculum, and because of that, and because of his reassuring me that I was indeed smart enough to pursue this field, which I did not think I was, but he insisted that yes, you can do it, and I stayed at Downstate to do my residency. As a resident, I was inspired by Mahendra Somasundram, who you see on the screen there. This is Dr. Somasundram. He was the core of our residency training. He inspired me to be the best neurologist I can be and the best educator. He was the consummate educator. In fact, he was the first distinguished teaching professor in the Department of Neurology at Downstate. And I am following in his footsteps in that regard. So he inspired me as an educator.
Lisa, you're over time.
Just a few more seconds for Roger Crackle. I cannot leave him out of my talk. Roger was a godsend. Roger is the one who gave me my faculty position, allowed me to stay on as faculty, and taught me about what it is to be an academic neurologist. He insisted that I cannot simply teach, which was the first thing that led me to want to stay. But he said, no, you've got to do research, which led me to Bob Wong's lab, which led me to a successful career in the research arena as well. God bless them both. And Roger, of course, was a distinguished service professor. So both their pictures hang on the wall when you walk in every day. And I miss them terribly. They both left us sadly over the past 2 years, and we haven't had an opportunity to mourn them because of COVID. But I hope I'm making them proud. Thank you.